All right, so welcome everyone. I'm so happy to have you all here today and joining us for this fantastic presentation on the Campus Mental Health Action Tracker. My name is Emily Ann Opala. I'm the Knowledge and Research Lead here at the Center for Innovation in Campus Mental Health, and I'll be your host today. To start off today, we wish to acknowledge that we're all viewing and participating in this webinar on traditional territories of Indigenous peoples of Turtle Island. So, to recognize the land is an expression of gratitude and appreciation to those whose territory we reside on, and also a way of honoring the Indigenous people who have been living and working on the land since time immemorial. It's important to understand the longstanding history that's brought you to reside on the land and to seek to understand your place within that history. So I'm coming to you all as a settler on Treaty 13 territory, which is the traditional lands of the Anishinaabe, the Haudenosaunee, the Huron-Wendat, and the Mississaugas of the Credit First Nation. And I encourage you all to go and look up for yourselves and find out what land you're living on and what's the history of that land and what kind of treaties exist on that land. So I encourage you all to do that. So just a little bit of housekeeping before we get started today. Closed captioning is available at the bottoms of your screens. I see that it's been enabled. So if you would like, you can go to the bottom of your screen where it says show captions and enable captions. The chat function is for discussing your thoughts and reactions to today's presentation. So feel free to jump in there if you have anything to say at all. I encourage you to start out in the chat today with sharing what land you're on, if you know what traditional lands you're on. Next, the Q&A function is for submitting questions to our panelists. So we will have a question period at the end of today's presentation. And finally, recording will be available on our website post-webinar. And we will have the slides available there as well. So now, without further ado, I would love to introduce our guests here at SRDC and NHCC. We have Sarah, Amy, Courtney, Jen, and Terry, and of course, JP, who's here supporting. Over to you, folks.
Merci, Emily. My turn, I think, to start speaking, and good morning, everyone. I think it is morning for everyone. Thank you for your interest in our work in advancing mental health in post-secondary. Campus Mental Health Action Tracker tool that supports post-secondary institutions in their implementation journey with the national standard for mental health and well-being for post-secondary students. Ceux et celles qui nous écoutent et qui parlent le français, je vous remercie pour votre intérêt à notre travail axé sur la santé mentale parmi les établissements d'enseignement postsecondaire et plus particulièrement à l'outil de suivi du campus en matière de santé mentale comme ressources et outils pour suivre les progrès et les parcours de mise en œuvre des établissements d'enseignement postsecondaire avec la norme nationale du Canada sur la santé mentale et le bien-être des étudiants du postsecondaire. It is so great now that in 2023, there is much interest in the tracker as a tool to help institutions track their progress with the standard and support the process of implementing an organization's student mental health plan and framework in alignment with the standard. Start with introductions. Hello, everyone. I am Amy Fogarty. I'm a manager at the Mental Health Commission of Canada. I'll say a little bit about our organization. At the Mental Health Commission of Canada, we work day in, day out to develop resources, influence sound public policy, convene stakeholders, and seek to inspire collective action. Our main offices are located on the traditional and unceded territory of the Algonquin and Anishinaabe peoples, which includes contemporary Ottawa. And in our work in particular, we endeavor to infuse cultural safety and humility into our initiatives and ensure the voices and experiences of Indigenous peoples are heard and listened to in the development and implementation of our work. One of the many areas of focus that we work on in mental health is that in post-secondary. And that's been for a number of years now. And we have heard secondary students who are already facing additional challenges to their mental health and well-being that Indigenous students face and have their own realities, and they face supplementary barriers to their well-being. So at the Commission, we are committed to continue gaining a better understanding of those specific realities and needs in order to fully support post-secondary institutions in their work to provide safer and more inclusive learning environments that are supportive of the mental health and well-being of everyone. I specifically, as a manager, I oversee our work in mental health and well-being in post-secondary. So also from the commission today are with me Sarah Ferguson, program manager who leads our work in post-secondary, as well as Jean-Patrick Laforge, who is program coordinator supporting all aspects of this work. And it's a pleasure to be speaking to you today with Social Research and Demonstration Corporation, or by its acronym SRDC, with whom we have a longstanding relationship in this work, particular pertaining to post-secondary. And in respect to post-secondary, SRDC has been supporting all aspects of our work and aspirations for tracking implementation efforts of the standard and evaluating its take for almost 5 years now, even before the standard was released. The post-secondary standard is just one particular project. I know SRDC works on several research and evaluation projects as a nonprofit organization. So perhaps I will invite Jen and Courtney to introduce themselves.
Sure. Thanks, Amy. Hi, everyone. My name is Geneviève Mack. I'm a senior research associate at SRDC. It's been a couple of years now. We're working on this beautiful project, as Amy mentioned. So today we have Courtney Lord, who is mastering all the behind the scenes secrets of the tracker, being the administrator of the website and point of contact with institutions who are using the tracker. She will do later a presentation on the tool itself. And she's located in Wellersburg, Ontario. And we have Terry Slade also. Terry is also a point of contact for institutions. She speaks French too. And she's located in St. John, Newfoundland. And I'm located in Montreal. And yeah, we will try to do a bit of a demonstration today of the tool.
Merci, Geneviève. A quick overview for our plan for today's webinar. I just start off by sharing briefly about the standard, what it is, how it was developed, and how it supports post-secondary institutions in their work towards improving campus mental health. Then SRDC will share about the Campus Mental Health Action Tracker tool, what it is, how to use it, and the benefits of using it. And we'll conclude with some tips on how institutions have been using the tracker to support their work with the standard, and of course have time for questions and answers at the end. So if that sounds great, we'll get started. Taking a moment to recognize that the number of students in colleges, institutes, cégeps, and Polytechnic Canada, that stands at around 2 million. And just for context, since 2013, we at the Mental Health Commission of Canada, we championed a standard for psychological health and safety in workplaces. And 5 years later, by about 2018, we were seeing its uptake in the education sector. But that standard was meant and geared towards faculty and staff, and not necessarily students. So we at the Commission were approached by some stakeholders to see about leading some work in post-secondary and fill the gap. So in 2018, we embarked upon championing the development of another voluntary standard, one for post-secondary. And that was made possible thanks to the support of funders such as Bell Let's Talk, the Rossi Foundation, and the RBC Foundation, as well as our main funder at the Commission Health Canada. And we worked throughout that process collaboratively with the CSA group as the standards development organization to develop the standard. The CSA group put together a technical committee of about 35 subject matter experts. And our role at the commission also at that time was gathering an executive advisory committee to work with the technical committee on this project and guide its development. Some of those members and organizations like Colleges and Institutes Canada, Universities Canada, and the Canadian Association of University Teachers, just to name a few. Donc, la première de son genre au monde, the first of its kind in the world, the standard is voluntary, and it's a flexible set of guidelines aimed at promoting and improving mental health of students in post-secondary institutions across Canada. And the standard is grounded in a commitment to continuous improvement, and it's designed to be adaptable to the unique needs and circumstances of each institution, regardless of size, student demographic, location, or particular circumstances. And that means each institution can determine its own priorities for improving student mental health and well-being over time, no matter where they start. And that starting context is, particularly important here because we know that work in student mental health was well underway for many years before the release of the standard, before the pandemic, but in particular, the last 2-3 years have really emphasized the ongoing need for this work, as we have seen rates of anxiety among secondary institutions continue to increase. In particular, from 2018 through 2022, anxiety symptoms among students in post-secondary increased by 29%. Meanwhile, 1 in 3 students were reporting that mental health services at post-secondary institutions do not meet their diverse needs as recently as last year. And now we are encouraged to know that post-secondary institutions are looking to the standard with confidence in its content to be able to guide their efforts to continue their journey of continuous improvement with respect to mental health and well-being for the entire campus community. Of course, that includes students. The standard really presents an opportunity for post-secondary institutions to reaffirm their commitment to promote student mental health and well-being. And it offers a platform for collaboration to support institutions in identifying their strengths, where there may be gaps, and areas for further action. And I'll just add, the standard was released in the fall of 2020 in the midst of a pandemic, and we're just proud at this point to know that post-secondary institutions across the country have been working with it since they've had that opportunity. And I would add here, as the first quarter of 2023, almost 2.5 years after its release, the standard has been downloaded thousands of times and has drawn interest internationally as well, with downloads in Australia, the US, and France, and other countries. And so within the standard, just touching on some of the major dimensions that institutions should be addressing as guidelines, that covers institutional factors such as leadership and policies, the need for planning, in particular data gathering and having an action plan, as well as it covers the components of the socio-ecological framework, such as crisis management. It touches on the importance of evaluation and reporting, and as well as that emphasis on continuous improvement through strategies and how each institution takes these dimensions and puts them into action is really up to them, which is why it's flexible. Wanted to touch briefly today on the benefits of aligning with the standard. You may not see this every day, but the goal of the standard is to really provide a consistent evidence-based framework that post-secondary institutions can use to enhance their existing mental health strategies or develop new. So as the clauses of the standard are implemented, it will be supporting these key outcomes. First and foremost, that awareness piece, because we know stigma is very real and still exists. And with greater emphasis on mental health, we can gear our efforts towards reducing stigma around mental health through increased mental health literacy, which is reflected in the standard. Also looking at increasing access for student supports, both on and off campus. Gearing towards better life and resiliency skills that students can use in their daily lives, both not only at school, but also at work. And looking towards healthier and safer institutional environments that are conducive to student mental health and well-being, and an overall sense of improved opportunities for student success and flourishing. What really resonates with me as well throughout the standard are the guiding principles that played a large role in how the standard was developed. So I think this is particularly meaningful. This is reflecting much of your work that's ongoing already, I'm sure. First and foremost, that a lot of your efforts be student-centered. So that first guiding principle, means that really prioritizing mental health and well-being of students means including them in the process of developing, implementing, and evaluating an institution's framework. There's also that emphasis on equity, diversity, and inclusion, that all efforts be knowledge-informed and be health-promoting and harm-reducing, promoting that sense of thriving community and cultural well-being, and of course, the emphasis on continuous improvement. And with that, institutions can look to these 6 guiding principles to support their alignment with the standard as they develop and implement a mental health framework, assess policies, procedures, and practices to support and improve the mental health and well-being of students. So I'll pause there and pass it to my colleague, Sarah, to tell us more about the journey of shared responsibility.
Thank you, Amy. So as Amy mentioned, in covering the different guiding principles and dimensions of the standard, you can see that it covers a very broad range of topics, yet it is aspirational in its aims, and it's meant to support institutions wherever they are in their journey to improve student mental health and well-being. Meeting the clauses of the standard isn't necessarily a destination to be reached, but rather an iterative process of continuous improvement as institutions, the student demographic, and the mental health landscape are continuously changing. We also know that work with the standard can't be done by post-secondary institutions alone. It requires a community in order to respond to the growing challenge of supporting student mental health and well-being. Work with the standard is a shared responsibility that includes students, faculty, and staff as key stakeholders in the process, as well as stakeholders in the broader community to further holistic student well-being. Since the release of the standard in 2020, we have developed and released additional implementation resources to support institutions in their journey with the standard, and one of those is our starter kit. The starter kit was developed to accompany the release of the standard, and it's intended to support institutions to begin aligning with the clauses of the standard. A summary of the standard is included within the pages of the starter kit, which is a really useful reference to become more familiar with what the standard covers, which includes aspects like leadership, policy and practice, stakeholder engagement, planning, strategy development, privacy and confidentiality, crisis management, tracking your progress, and evaluation, all with an eye towards continuous improvement. The starter kit is available on the Commission's website, and the summary is found on pages 20 to 22, and we can also share a link to the starter kit in the chat. The standard and the starter kit also include a sample audit tool to help jumpstart work with the standard, which is often the first step that institutions take as they begin working with the standard. The audit goes through the clauses of the standard and can help highlight areas in which work is already being done in alignment with the standard, as well as areas that require further work. The audit tool is at the very back of the standard, starting on page 37, and you can also find it at the very back of the starter kit. And this is a good jumping off tool to talk more about the Campus Mental Health Action Tracker, so I will pass it back to Amy.
Merci, Sarah. And I will just say we're so pleased to have an opportunity today. So thank you to CICMH for this chance to showcase the Campus Mental Health Action Tracker that both the MHCC and SRDC were instrumental in developing as an additional tool for post-secondary institutions to use in tracking their implementation efforts of the standard. So much like the standard, the tracker would not have been possible without the support, namely financial, of funders, Bell Let's Talk, the Rossi Foundation, and RBC Future Launch, and MHCC by way of Health Canada. So we thank them for their vision and wanting to make available a tool to nuance the self-assessment process and beyond. And really what's possible beyond that sample internal audit tool found in Annex A of the standard. So with that, I will invite Geneviève to tell us more about the tracker.
Sure, thanks, Amy. Bonjour à tous, hello everybody. So let's dive into the tracker itself. So it's been a few years now that we developed the tool. Its development is based on research and best practices in the post-secondary sector, but also into like in-depth analysis of surveys and resources in Canada, United States, and UK. It has been greatly influenced by a reference group with a couple of post-secondary institutions highly engaged in the process. So, en formant le groupe de référence, la commission a vraiment veillé à ce que la composition du groupe comprenne des établissements de taille de types différents. C'est important aussi de noter que les membres du groupe de référence qui ont contribué à l'outil se trouvaient tous à des étapes très différentes de l'alignement de leur politique et de leur pratique sur la norme. And this has been, you know, it has helped us like to guarantee that the tool was adaptable to the context of each institution. So, and for like each institution could be at different steps of implementing the standard and being able to use the tool. Next slide, please. The design and development of the tracker was driven by 6 guiding principles. The first one is has to be confidential and secure. It was important for us that each institution's data and information would be safe and secure within the tool. There are several security features that mean no institution's data is ever shared with anyone external other than SRDC and our IT and web support team. So again, it has to be user-friendly. So to support the standard, which is highly comprehensive, it was important that we design any online tool to be user-friendly and easy to navigate. Third, it has to be collaborative. Given the depth of the standard and the self-assessment process, the tracker was designed to facilitate opportunities for collaboration among team members within each institution. It has to be action-oriented. As an implementation support tool, it was important this tool to be practical for action planning as well as assessment. It has also to be, aligned with the standard itself. So the feedback from the reference group made it clear that alignment with the standard, both in the structure of the tool and the language used, was a priority. And finally, had to promote reflection. The tracker was designed to facilitate in-depth reflection on each aspect of the standard to document learning and track progress over time. So since the standard is aspirational, we designed the tracker with the idea that developing an institutional response to student mental health priorities is an ongoing process, with lots of learning and opportunity for new priorities to emerge. We use the metaphor of a journey to also underscore the idea that every institution is at a different place on this journey, and that this will vary across the different elements of the standard. This and the next few slides illustrate the rubric of the self-assessment process, the stage of implementation for each element of the standard. So the first option for the self-assessment is not yet. So your institution leadership has shown some intention toward the development of a student mental health framework, but has yet to complete engagement or planning in a concrete manner. So next step would be start. Your institution recognizes its role and responsibility in supporting students' mental health and well-being, and is taking some good steps toward a framework of policy, processes, system, and supports to facilitate this. So the third step would be good progress. Your institution has taken effective action to develop our policies, processes, system, and supports for students' mental health and well-being. You are making great progress toward meeting all requirements of the standard. And then we're close because we never attained our objective, right? So your institution policies, processes, system, and supports for student mental health and well-being are truly developed, integrated, and embedded across your institution. Your institution meets all required and recommended elements of the standard, and you can focus on monitoring and continuous improvement until your next assessment. So over to you, Terry.
Thanks so much, Jen. So as we talked about at the beginning, the central functions of the tracker were meant to mirror that of the standard. So we have these core functions to be useful for identifying priority areas for individual users and for institutions. And the institutions, of course, they contribute to the work with the tracker collaboratively. We want them to be able to document the rationale and the sources used for informing the stage of implementation decisions. Of course, these decisions for the stage of implementation are based on each contributor's own perceptions of how things are working within the institution. They can work collaboratively to make decisions about what that stage of implementation is. We need them to be able to track, assess, and visualize their progress over time and facilitate collaboration with institutional stakeholders. Within the tracker, institutions can have multiple contributors and they can work collaboratively, as you'll see in Courtney's demonstration in just a few minutes. Finally, we wanted users to be able to identify strengths and gaps in the institution's policy, program, and practice. Next slide, please. Thanks. In the structure of the tracker is really aligned with the standard. And so the dimension and domain structure mirrors that of the standard. So within each dimension, there's a number of domains, and within each domain is a number of clauses, which in the tracker are represented by questions. You'll get to see how those look in a moment. Each dimension is independent of one another. So they're listed in a numerical order here, but each dimension is standalone. So users of the tracker can start with any dimension that they like and do them in whatever order they want. So the first one in the order that they appear is institutional factors, and that aligns again with the standard. The domains within Dimension 1 are leadership, commitment, policy and practice, and confidentiality. There's also a section of questions within the tracker mirroring that of the standard that we called recommended. In the standard, those are, if you recall, in the standard, they're listed as shalls and shoulds. Leadership, commitment, policy, and practice, and confidentiality are all the shalls of the standard, and the recommended are the shoulds of the standard. Dimension 2 is planning. So the domains within that one are psychological factors, gathering data, objectives and targets, action plans, and again, those recommended items. Dimension 3 is socio-ecological framework, the domains within that being supportive, safe, and inclusive environment, education and stigma reduction, accessibility, early intervention, mental health supports, crisis management, and postvention. Dimension 4 being evaluation and reporting with domains of general consideration and record retention. And Dimension 5, continuous improvement, has a domain of reviews. Again, each of those having the domain or the section of recommended clauses or recommended questions. Using the tracker, you can complete assessments by choosing a stage of implementation that you feel best represents your institution's progress on each of the items. Again, the items represent the clauses that are listed in the standard. So for example, one of the questions is, to what extent does our institution keep a record of data collected and the methods used for evaluation? And if your institution is, say, currently drafting a protocol or a summary of data collection efforts, you might choose the taking steps option. Once all the questions within a dimension are answered, you can get a sense of where your institution is at along the journey towards student mental health and well-being. These ratings are amalgamated by the tracker to develop an overall rating for each dimension. And Courtney is going to show you what that looks like. So I'll hand it over to Courtney to provide a short demo of the tracker so you can see what it looks like in real time.
Thank you, Terry. So I'm just going to go ahead and share my screen so that everybody can have a look at my browser. Just bear with me while I get us set up here. Okay. Hoping everyone can see that. Excellent. Okay, so I'm just going to turn off my camera. There we go. Okay, so as Terry mentioned, I'll be giving a brief demonstration of just some of the key features of the tracker and how those features work. So to start, I'm going to bring us to what we call the dashboard on the My Assessment page. And this is what users are immediately directed to when they first log in. The dashboard gives a sort of first glance at a user's progress and also acts as a doorway to a user's assessment. So you'll notice the 5 differently colored boxes here. These represent the 5 dimensions of the standard. As Terry mentioned, we have tried to model the structure of the standard within. And these percentages that you see here are the dimensional scores. And I'll be talking more about how exactly those scores are calculated and how they should be interpreted just a little bit later in the demonstration. Now, if I use my mouse to scroll over each dimension, you'll notice that it gives you information about that dimension, including the number of questions within each one. There are actually a total of 88 questions across all dimensions of the tracker. You'll also see each box provides a breakdown of how many required questions there are and how many recommended questions there are in a dimension. And this is another way that the tracker has been designed to mirror the structure of the standard. As Terry mentioned, the standard does use the language of shalls and shoulds. And you can sort of think of the shalls more broadly as a sort of core criteria of the standard, and the shoulds being more nice to haves, although they are all equally important for student mental health. And I'll get into how that structure sort of feeds into the scoring piece as well. So I'm gonna go ahead and show you what happens when I click on a dimension. So I'll just start with dimension 1, although as Terry mentioned, that's not a requirement when you're completing your assessment. So when I click on a dimension, you'll see a list of domains, again, mirroring the structure of the standard. And you can use the addition symbols here to the left to expand your domain. And when you expand a domain, you'll see a list of items appear. These are actually your assessment questions. So in cases where you've already responded to questions, you'll see the responses and information that you input appear in these columns along the right just here. So when you want to respond to a question, or perhaps even just change a previous response, for example, if you've learned new information that impacts your assessment, you can just go ahead and click on the item that you want to start with. And this brings us to a page where you can view the question and respond. And the questions will always appear up top just here. And you can see that there's essentially 4 ways that you can respond to a question. And the first and sort of really primary way that you can respond to a question is by selecting the stage of implementation from the drop-down menu here. You can see there are those 5 stages that Terry went over. And sort of going back to what she mentioned, these stages are users are essentially being asked to assess where they think their institution is in reference to the question above. We've also provided a drop-down menu where you can select a priority level for that item. As we've mentioned, the standard is very comprehensive, so we don't expect any institution to be able to address all items across all dimensions simultaneously. Rather, we've embedded an option where you and your collaborators can prioritize items, choosing between low, moderate, and high. Now, we also have these 2 text boxes labeled rationale and additional factors. Sorry. So why we've provided these is so that you can essentially justify your choice from this drop-down menu, the stage of implementation. And the reason that we wanted to give users these options is because choosing a stage of implementation is a very subjective exercise. So by providing these text boxes, users have an opportunity to provide additional information to support their selection and explain how they came to the decision that they did. So as you can see in the left-hand text box, the rationale text box, you can input a description of your rationale or your justification for selecting your rating. And you can mention things like any metrics or indicators that you used, or perhaps any sources that you drew from. In the box to the left, the additional factors, you can input any contextual factors that influenced your selection. And this can include things like campus culture, maybe recent events. A prime example of an additional factor might be the pandemic and the impact that it had on institutions and on student mental health. So I just want to return to the dashboard briefly that I showed you earlier. And the reason why I want to come back here is I just want to talk about how the dashboard serves as a first glance at your progress. So these dimensional scores, these percentages that you see here, again, they are related to the stage of implementation rating that you select for each question from that drop-down menu. Scores are based on these responses because each item or each stage of implementation rating actually has an assigned numeric value to it. So each dimensional score is actually calculated by adding up the point value of the selected ratings for each required question within a dimension. So this sum is divided by the number of the total possible points and then multiplied by 100 to generate a percentage. Only required items are included in the scoring calculation, as I mentioned, because they're sort of considered more the core criteria. Recommended items are not included in the scoring equation. So what you see here is actually the result of individual user input. So this is a reflection of just this account user's responses, namely mine. But institutions can also have multiple user accounts, allowing for easier collaboration amongst team members. So as a result, the tracker has been designed to calculate scores, not just for individual users, but it can also calculate scores that include the input of multiple users. So in the case of an institution that has multiple users associated with it, in that case, the most frequently selected response rating, that drop-down menu for stage of implementation, the most frequently selected response, or what we call the modal response across users, is identified and then used to generate a score that reflects the responses of all users within an institution. And this is why you might actually notice a difference in dimensional scores on the My Assessment page and what we call the group assessment page. So as the names indicate, the My Assessment page only considers and calculates using the input from that individual user's account, whereas the group assessment page displays a score that includes and calculates from the responses and the input from all users associated with the same institution. And I just want to stop and make an important point that the scoring system is intended to help institutions quantify their current state of alignment with the standard and track their implementation progress over time. It's important that institutions and users don't view the scores in the same way you might view a grade or a test score. To sort of take us back to that journey metaphor that we used earlier, when institutions complete their first or essentially their baseline assessment, a dimensional score is meant to help institutions kind of identify where they are on a map or identify their starting point at the beginning of a journey as it relates to each dimension. So as institutions conduct subsequent assessments, the scores are then meant to act as an indicator of how much progress has been made since their initial assessment, or better yet, how far along their journey they've come towards aligning their policies with the standard. So next, I'm going to show you our group assessment page. And what I really want to draw your attention to here is the way the group assessment page allows users to generate and customize reports. So users can choose to print or save a PDF of their report in its entirety. Or if they have specific reporting interests, they can customize the report using a number of filter options, including filtering by dimension, by domain, by progress, which is the stage of implementation rating, or they can filter by priority level. We also have a CSV download option, which can be opened in Excel, and a PDF download option. And both have the potential for being useful for high-level reporting or meeting update resources. Now, I am mindful of the time, so I'm just gonna switch back over to our PowerPoint so I can discuss a little bit about how the tracker was designed and how institutions have been using it and some sort of tips for success. So I'm just gonna stop sharing on my end. And we'll just bring back up the PowerPoint. Perfect, thank you. Okay, so Jen did mention earlier that we designed the tracker to be sort of flexible for different institutions and fit the context of different institutions. So different sizes, different types. And as we've been piloting this, we've collected feedback from institutions on, what approaches they found to be successful when they were conducting their assessments and sort of their plans for moving forward in using the tracker. So for tips for success, one recommendation from institutions was to break your assessment down into smaller steps. As we've said, the standard is very comprehensive, but the tracker was designed to approach the standard in a way of sort of smaller actionable steps. and institutions have found success when approaching their assessment in this way. Institutions have also reported that using the tracker and conducting assessments can be a difficult task to accomplish if this is the type of thing that you're sort of working on from the side of your desk, so to speak. And so the recommendation is to have an individual or a team of individuals who are given an opportunity and have the resources to sort of take the standard and take the tracker and really run with it and really champion it as part of a wider initiative towards student mental health and well-being. Institutions also recommend engaging with students as much as possible and throughout the assessment and the implementation processes. Adding student voices can give institutions a greater understanding of existing gaps or opportunities for growth. Just overall and generally, we recommend utilizing community expertise, and that's ranging from students to other key stakeholders, as far as helping to identify strengths, opportunities for growth, and really gaining an understanding of potentially effective strategies for addressing different challenges. And of course, our last point, know when to stop collecting data and start taking action. And I think it's clear that we all know it can be challenging when it comes to translating knowledge into action and initiating an implementation stage or even planning for an implementation stage. So we really want to encourage institutions to use the information that they learn from conducting assessments to help inform planning, inform the identification of priorities, and inform strategy, because the tracker is meant to be a support tool for institutions to take steps towards further alignment with their policies and the standard. So in speaking with institutions in terms of getting a sense of how different institutions have been and can use the tracker, to start, institutions are using what they learn from their first or their initial baseline assessment to identify where they are in relation to the standard, to identify any opportunities for growth, and inform the setting of priorities as they take steps towards planning and implementation. Institutions are also using the tracker to track outcomes for their data collection. Essentially, institutions typically conduct several consultations with a number of different stakeholders and stakeholder groups. And the tracker has been a useful tool for users in documenting and tracking the outcomes of those consultations. And lastly, due to the tracker's ability to support tracking progress over time, institutions have reported plans to use this tool to support things like ongoing assessment, evaluation, and reporting. And lastly, just really quickly before I hand things over, I just want to let everyone know that we are currently at a stage where we're onboarding new institutions. So for anyone that is interested, please reach out to us. You can contact us by email at info@mentalhealthtracker.ca. We also have a contact form that can be used to reach out to us on our website, also mentalhealthtracker.ca. And we'd be happy to answer any questions or explain the steps involved with getting an account and being able to access and use the tracker. So with that, I am going to hand things back over.
Excellent. Thank you all so much for that really informative and very helpful presentation. I think folks in the audience got a lot out of that. That was fantastic. I think we all learned a lot, and we have already a couple of questions in the Q&A function. So I'll go ahead and pose those to the group. And this is really, I believe these questions are for anyone, so just go ahead and jump in if you have an answer. So the first question is from Anna, and she asks, how can we know if a certain institution is using the Campus Mental Health Action Tracker? Can they know? That's a good question.
So just to clarify, in terms of how can we know if a certain institution, is the question related to how can we know if any one institution or another institution? Because with the confidentiality, and unless that institution happens to tell you that they're using it, we don't share that information. And part of it is so that it doesn't turn into sort of a McLean's rating system. It's there for a self-assessment. It's there as an indicator of your progress over time. It's not meant to be something where you're comparing and wondering what standards are being compared to what.
I think that's a very clear clarification. Thank you for that, Courtney. I think that hopefully answers that question. So we have another question here from an anonymous attendee that says, re-include student voices as much as possible. Where is it recommended to include student voices? Oh, well, it looks like we have already an answer to this question, which is great. Thank you, Amy. But maybe other folks might have some other things to add. So where is it recommended to include student voices other than collecting feedback? How would an institution include student voice and involve students in the design and implementation of the mental health initiatives, and at the same time communicate to the students that that the final decision is up to the administration, how to manage student expectations? So Amy's got a really great answer here already. Does anybody else have anything they want to add? Oh, I believe here.
There we
Oh,
go.
for some
Is that
reason-
better?
There we go. Yes.
Okay. I would just add, as an example, maybe it can be helpful that institutions have done things like focus groups with students, or they involve students directly in the working groups that are working with the standards. So that's maybe a practical example of how students have been involved in the work on an ongoing basis. And we know that that looks different across universities and colleges because the timelines for students staying in those degrees are different. So the length in which students might be involved in these focus groups might differ, but that's a way that is a tangible way to center student voices and get their feedback and insight into what their needs are.
I would also add to that, Emily, that many institutions are using feedback that they collect from students, whether it's through surveys and regular connections with students to feed into their strategies and frameworks. And from what we've heard from institutions that are doing that students are very appreciative of that and being offered the opportunity to provide feedback and actually being asked and engaged through surveys and connections with students. So I think that's something that institutions are doing on a regular basis, but yes, continuing to emphasize that journey of continuous improvement and just keeping in mind that this is likely to be a multi-year journey. So there's lots of opportunities to engage students along the way.
Awesome. I also want to add, just for this particular anonymous attendee, that we have another webinar in our archive on co-design and engagement, student engagement. So I would recommend that you go and check out that webinar. Great. We got some more questions coming in, so this is great. We got lots of questions. Our next question is, as a grassroots worker, how do we fit in as we don't know if our institution is doing the tracker / following the standard? I think this is a little bit of a tough question, but maybe folks have some insights for Stephen.
I think we're just sort of judging from the looks on everyone's faces. I think we're all sort of debating what the context would be here. For example, it sounds like an individual who works with an institution, either for or with an institution, but doesn't have the contacts within that institution to find out if they're currently, reviewing the standard or using the tracker to look at implementing along with that standard. I mean, a sort of more broad answer, and Jen, Amy, maybe you can sort of add to it, is obviously trying to find out who those contacts are at that institution. Oftentimes they can be within sort of student wellness departments, but not necessarily. So it may take a little bit of exploring. But reaching out to the different contacts within that community, within that institution, to try and clarify what work is being done in this area.
Maybe I would add to that, if I may, Courtney and Jen, is that I'm thinking of the person's seat and the work that they do. If there are any linkages, and this is quite broad, but implications for well-being and mental health, if there are any reports or results that you could point to, I think that would be something that would be really great to share with someone who you might envision within your institution that is doing this work, to help them make those connections. I don't know if that helps.
Really helpful. Yeah, thank you. I think that was very helpful. So moving on, are there any restrictions on the types of educational institutions that are allowed to use the tracker? I think we'll go to SRDC for this one.
So the tracker was designed mostly for colleges, CEGEP, and universities. So I'm not sure like the types of educational institution, but the standard was really, you know, and Amy, correct me if I'm wrong, but really, you know, targeting those 3 types of institutions. So the tracker is just following the same scope, right? So it's not designed to, like, for instance, about like any other type of institution. So I'm not sure what type of educational institution that would be. So if you can precise, good, but it was really targeted for post-secondary institution. Yeah.
Yeah, and I just add to that, Jen, we haven't had any opportunities to sort of test this out with, you know, other educational institutions like K to grade 12. And it was, as you said, Jen, really aligned with the same aim and same groups as the standard.
Great. So I think we have time for maybe 1 or 2 more questions. So this is a little bit of a different kind of question, but here we have from an anonymous attendee. The national standard lacks specific guidelines and actionable steps for implementation. This leaves room for interpretation and inconsistency across institutions. How does the action tracker address this?
So the tracker is really a self-assessment tool, a collaborative tool. So it's really about how institutions view themselves in the process of aligning their policy with the standard, right? So so again, it's not an assessment tool like you know, typically, or like measuring it like in a an objective of like attaining an objective or something. So it's really aspirational, and it's a self-assessment tool. So I'm not sure, Amy, like how you would complete this, but I feel like it's not about inconsistency, but more about our institution view themselves in the process.
I think that's a great clarification. Thank you, Jen.
Emily, can I add to it just before we
Yeah,
move on?
please.
So I see the question, as I interpret it, as specific to Nova Scotia. And what I would add is that the standard is really for Canada. So in terms of its, you know, its application, certainly it's voluntary. So specific guidelines and actionable steps are actually reflected through the clauses of the standard. So where my mind goes is reflecting back and thinking about the audit tool. And that could be an opportunity for an institution to take a look at, you know, where am I at in terms of aligning with the recommendations of the standard. And that might alleviate some of that confusion, or, you know, thinking of interpretation for an institution, but it is, you know, specifically flexible to meet an institution where it's at. So, you know, if an institution is currently prioritizing certain aspects of, you know, a strategy or a framework, you can look to the guidance of the standard to go a little bit further and a little bit more in depth on that. And you know, if you are interested in the tracker, of course, it's organized around those 5 dimensions that are, of course, reflected in the guidance of the standard. So whether you're looking at institutional factors, you're looking at planning, thinking of the socio-ecological framework and those components, or if you're emphasizing evaluation and reporting or continuous improvement, the tracker can certainly help address that. If you are at a state where you're thinking of, it would be great to start using the tracker. That's one way that
That's really helpful. Thank you, Amy. All right, so seeing that we have 3 minutes left, unfortunately, we won't be getting to all of the questions. If folks have some answers that they'd like to answer in typing those questions, please feel free. Meanwhile, I will close up. So I'd like to say thank you so very much to both SRDC and MHCC. It's been really fabulous to have you all join us here today. I think that folks learned a lot. Just to remind folks that yes, this webinar has been recorded and will be available on our website in just a couple of hours. I'd like to thank you all for coming here and joining us today. It's been a pleasure to have you all. Just a reminder, our next webinar is going to be on problem gambling in the campus context. So we're going to be talking a little bit about iGaming and gambling as it relates to students. And how that has changed over time with new laws in Canada regarding gambling, and how we can best support students with problem gambling. So that's our next webinar. I want to remind folks to please check out our website, campusmentalhealth.ca, as well as morefeetontheground.ca, which is a free course to learn how to recognize, respond, and refer someone to mental health services. Finally, I'd like to remind you all that there will be a survey that will pop up on your screens after this webinar closes. I invite you to please take 2 minutes and respond to that webinar survey. It gives us a lot of information and helps us with our future webinars. So thank you so much, everyone, for attending, and we will see you next time. Take care.